If you have type 2 diabetes or you are managing prediabetes and you have been standing in the dairy aisle genuinely unsure whether the cheese or the yogurt in your hand is helping your blood sugar or quietly working against it, you are asking exactly the right question and you deserve a precise answer. Not a general wellness answer, not a calorie counting answer, a metabolic answer that explains what each of these foods does inside your body at the level of glucose response, insulin secretion, gut microbiome composition, and inflammatory tone. Because cheese and yogurt are not metabolically equivalent, despite both being dairy foods made from the same starting ingredient, they arrive in your body differently, they interact with your insulin system differently, and for someone managing blood sugar, the distinction between them is clinically meaningful. Today, I am going to give you that distinction completely. My name is Dr. Stephen Moss. If you are living with diabetes or prediabetes, this channel exists entirely for you. Every video I make is designed around one goal, giving you the information your doctor does not have time to sit down and explain. We are working toward 10,000 subscribers who are serious about taking their health back. And if that is you, hit subscribe right now and join us. Now, I want to begin by establishing the metabolic framework that makes this comparison meaningful before I go into each food specifically. When we evaluate any food in the context of type 2 diabetes, we are asking four questions simultaneously. What does it do to blood glucose directly? What does it do to insulin secretion? What does it do to the inflammatory environment that determines insulin receptor sensitivity over time? And what does it do to the gut microbiome, which is increasingly understood to be a primary upstream regulator of all three of the preceding variables? Cheese and yogurt give different answers to each of those four questions. Let us go through them. Cheese first. Hard and semi-hard cheeses, the varieties most commonly consumed, cheddar, Gouda, Parmesan, Swiss, Brie, contain virtually zero carbohydrates. A standard 1-ounce serving of cheddar delivers approximately 0 to 1 gram of carbohydrate, 7 grams of protein, and 9 grams of fat. From a direct blood glucose standpoint, this is one of the most favorable macronutrient profiles of any commonly consumed food. Cheese produces no meaningful glucose entry into the bloodstream from the food itself because there is essentially no carbohydrate to break down. The glycemic index of hard cheese is effectively 0. In that respect, cheese and eggs share the same fundamental metabolic advantage. They do not generate a glucose event. But cheese's relevance to blood sugar management goes beyond simply not causing a spike. The fat content of cheese, particularly its high concentration of saturated and monounsaturated fatty acids, produces a significant gastric emptying slowing effect on any carbohydrate consumed in the same meal. When cheese is eaten alongside bread, crackers, fruit, or any carbohydrate source, the fat delays gastric emptying substantially, flattening the glucose absorption curve from those carbohydrates. Research published in the American Journal of Clinical Nutrition found that dietary fat consumed alongside carbohydrates reduced post-meal glucose peaks by a meaningful margin through this gastric emptying mechanism. Cheese is not just neutral for blood sugar. In a mixed meal context, it is actively protective, slowing the glucose delivery from accompanying carbohydrates in a way that reduces insulin demand from the meal as a whole. The protein in cheese stimulates a modest insulin response through the direct amino acid and incretin pathways I've described in previous videos. This response is significantly smaller in magnitude than what carbohydrates produce and is accompanied by the same gastric emptying slowing that the fat provides, creating a slow, sustained, moderated insulin environment that is the opposite of the spike and crash pattern driving reactive hunger and progressive receptor desensitization. Research from the European Journal of Clinical Nutrition found that cheese consumption produced one of the lowest insulin responses per gram of protein among common protein-containing foods, attributable to the combined effect of its fat content and the specific amino acid profile of aged dairy protein. Here is one aspect of cheese consumption specifically relevant to type 2 diabetes that has received significant research attention in recent years, and that most people managing blood sugar have not encountered. Cheese contains short-chain fatty acids produced during the fermentation and aging process, including propionate and butyrate, that have direct documented effects on hepatic glucose production. Propionate in particular is absorbed from the gut and travels to the liver, where it inhibits gluconeogenesis, The overnight glucose manufacturing process I have discussed extensively in the context of fasting blood sugar elevation. Research published in the journal Gut found that propionate from fermented dairy products significantly reduced hepatic glucose output in human subjects, and that regular consumption of aged cheese was associated with lower fasting glucose independent of overall dietary pattern. The fermentation byproducts in cheese are doing metabolic work that the cheese's macronutrient profile alone does not explain. The inflammatory picture of cheese is more nuanced and depends substantially on sourcing and type. Conventional dairy from grain-fed cows has a less favorable omega-6 to omega-3 ratio than cheese from grass-fed animals, and the inflammatory implications of that ratio difference are real in the context of long-term insulin receptor function. Research from the British Journal of Nutrition found that full-fat cheese from grass-fed cows had a significantly higher conjugated linoleic acid content, a fatty acid with documented anti-inflammatory and insulin-sensitizing properties, compared to conventional cheese. The inflammatory case against cheese as a category is substantially weaker when the comparison is made against grass-fed sourced products rather than conventional ones. If you are consuming cheese regularly as part of a blood sugar management protocol, sourcing matters enough to influence the long-term inflammatory outcome. Now yogurt, and I need to establish immediately the same critical distinction I have made before in this series, because yogurt is not a single food any more than oatmeal is a single food. The metabolic difference between plain, full-fat Greek yogurt and low-fat flavored yogurt is large enough that treating them as the same product in a blood sugar conversation is genuinely misleading. I'm going to focus this discussion on plain, full-fat Greek yogurt because it is the form with the clearest and most consistent metabolic benefit for blood sugar management. And I will address the flavored low-fat varieties directly because the contrast tells an important story. Plain, full-fat Greek yogurt is produced by straining conventional yogurt to remove the whey, which concentrates the protein, reduces the carbohydrate content, and increases the fat concentration relative to unstrained yogurt. A standard 6-ounce serving of plain, full-fat Greek yogurt delivers approximately 17 grams of protein, 6 grams of fat, and 6 to 7 grams of carbohydrate, primarily as lactose. The lactose content is what gives yogurt its small but real glycemic contribution, the point at which it diverges from cheese. Lactose is a disaccharide that is digested into glucose and galactose, producing a modest blood glucose rise that cheese does not produce. However, the glycemic index of plain, full-fat Greek yogurt is low, approximately 11 to 20 depending on the study methodology, because the high protein and fat content of the product slows lactose digestion and absorption substantially. The glucose rise from plain, full-fat Greek yogurt is real but small and slow, well within the range that a metabolically compromised insulin system can manage without significant difficulty. The protein content of Greek yogurt is where it separates from cheese in a way that is directly clinically relevant. 17 grams of protein per serving places Greek yogurt among the highest protein density foods available in a standard grocery store. That protein stimulates a more substantial GLP-1 and peptide YY response than cheese's 7 grams per serving, producing more robust satiety hormone signaling that suppresses hunger more effectively and for a longer duration after the meal. Research from the International Journal of Obesity found that high-protein dairy consumption at breakfast significantly reduced appetite and caloric intake across the subsequent 8 hours compared to lower protein alternatives. The hunger suppression from Greek yogurt's protein content is a secondary metabolic benefit that reduces the frequency of post-meal glucose events driven by premature hunger and snacking. But the most significant advantage yogurt holds over cheese in the context of type 2 diabetes management is one that operates at a level that neither the macronutrient profile nor the glycemic index captures. It is the living bacterial cultures that quality yogurt contains and what those cultures do to your gut microbiome, your intestinal barrier integrity, and the systemic inflammatory environment that determines insulin receptor sensitivity over time. Plain full-fat Greek yogurt from a quality producer contains live cultures of lactobacillus and bifidobacterium species that, when consumed consistently, colonize the intestinal environment and produce effects on gut barrier function, inflammatory cytokine production, and short-chain fatty acid synthesis that are directly and specifically relevant to insulin resistance. Research published in the Journal of Nutrition found that daily probiotic yogurt consumption over 8 weeks significantly reduced fasting blood glucose, fasting insulin, and HOMA-IR scores in patients with type 2 diabetes compared to a heat-treated yogurt control that contained no live cultures. The live cultures were the active variable. The reduction in insulin resistance was not from the protein or fat in the yogurt, it was from the bacteria. This is why the low-fat flavored yogurt comparison is so metabolically important to understand. Low-fat flavored yogurt removes the fat that moderates the lactose-glucose response, adds sugar that produces an aggressive glucose spike, and in many commercially processed versions uses heat treatment that kills the live cultures. You are left with a product that spikes blood sugar, stimulates a disproportionate insulin response, and delivers none of the probiotic benefit that makes plain yogurt genuinely valuable for people with type 2 diabetes. Low-fat flavored yogurt is not a worse version of plain, full-fat Greek yogurt. In the context of blood sugar management, it is categorically a different product with an opposing metabolic effect. So where does the direct comparison land? Cheese wins clearly on the acute glycemic metric. Zero carbohydrate, no direct glucose contribution, significant gastric emptying slowing of carbohydrate from the rest of the meal, hepatic glucose suppression from fermentation-derived propionate, and near zero insulin secretory response. For someone whose primary concern is minimizing glucose spikes and reducing insulin demand at any given meal, cheese is the more immediately favorable choice. Plain full-fat Greek yogurt wins on the long-term microbiome and inflammatory metric. The live bacterial cultures, the satiety hormone response from higher protein content, and the documented reductions in fasting insulin and HOMA-IR from consistent probiotic dairy consumption give yogurt a meaningful advantage in the category of sustained insulin resistance reversal over weeks and months of regular use. The practical guidance for someone managing type 2 diabetes is not to choose between them, but to use them with intention at different times. Cheese belongs in meals where you are eating carbohydrates and want maximum gastric emptying protection and minimal additional insulin stimulus. Greek yogurt belongs at breakfast or as a standalone meal where its probiotic benefit, satiety hormone response, and moderate protein-driven insulin stimulus combine to set a stable metabolic tone for the hours that follow. 2 to 3 servings of plain, full-fat Greek yogurt per week is the dose associated with meaningful probiotic colonization benefit in the research. Daily cheese in moderate portions alongside carbohydrate-containing foods is the dose that consistently demonstrates gastric emptying and hepatic glucose benefits. What you add to each one matters as much as which one you choose. Cheese eaten with refined crackers, white bread, or sweetened accompaniments partially offsets its gastric slowing benefit by adding a fast glucose load alongside it. Greek yogurt topped with granola, honey, or fruit jam converts its favorable glycemic profile into a glucose event. Top yogurt with a small handful of walnuts, a few fresh berries, and a pinch of Ceylon cinnamon. Eat cheese with non-starchy vegetables, eggs, or any protein that does not introduce a fast carbohydrate load. The food is only as metabolically effective as the context surrounding it. Both belong in a blood sugar-conscious kitchen. Now you know exactly where, when, and why. I'm Dr. Stephen Moss. I'll see you in the next one.